All right, so we're going to get started. This month's webinar is on acupressure for joint pain. So thank you to those who decided to join us in person. I know a lot of you decide to watch the replay, but we do appreciate those who come in person because they can ask their questions while they're here, which is really nice. So before we get started, I'm just going to introduce myself very briefly. My name is Jessie McCowan. I am the Educational Director for Tallgrass North America. I am the lead instructor. I do all of the grading and the additional educational parts, such as running these webinars, which I really enjoy. And we're going to get into what joint pain looks like, how it presents, different acupressure points to help, and how you can kind of help determine which indicators your pets are presenting with and what their root issue may be. So let's get started. So a lot of clients of mine, or potential clients of mine, come to me asking how they can help their animals' joints. And arthritis is probably one of the most common issues I see, mostly in senior pets. Sometimes it's a younger animal that has a sprain or an injury, and sometimes it's post-surgery, they need a little bit of healing. Maybe they're losing some musculature in their back end, but these are all forms of joint pain, and we're going to get into it. So one important thing to keep in mind is that animals interact with their environment. So as their environment changes, so will their health. Animals' joints support them based on their environment and their lifestyle. So if they're very busy and active, that's great, their joints will be healthy, but there's a very fine balance. And if there's too much or not enough of that exercise, for example, that could lead to joint problems. Not to mention that today's society is more compact and indoors than ever. Many household pets spend the majority of their time inside and walk on stairs and cement rather than grass, which has a higher impact than walking on grass and dirt. Genetic abnormalities are also increasing in frequency as dogs are overbred quite a lot or ignored in the household. For example, hip dysplasia in German Shepherds is very, very common. Something else you'll want to note about the meridians, and if you have one of these charts, I suggest you pull it out now real quick so we can look at it. But something I want you to note is that all of the 12 major meridians flow through at least one of the major joints in the animal's body. And I have the dog chart here, but the equivalent on the horse chart is also true, as well as the feline chart. So if we have an imbalance in one of the meridians, this can cause difficulty with joint mobility. If the chi is not flowing harmoniously through that meridian, it can cause blockages or stagnation. And if there are physical injuries to joints, this may physically injure the joint, which then causes the energetic imbalance. So it can come from either side, but just something to keep in mind. If you do have a senior pet, arthritis has a very high probability of occurring. This is probably one of the most common issues that I end up seeing clients for. And something else, if you've taken our overview of TCM class, you will have learned about the 5 elements and the correspondence chart, which talks about each of the characteristics of each of the 5 elements and how each one governs a stage of life. And the water element, which is kidney and bladder, govern the final stages of life. And this is the one that governs bone and joint health. So if you notice, for example, that your pet has some urinary incontinence, some joint issues, maybe some hearing problems, they're probably progressing into their later stages of life, and supporting that kidney is very important. There's a couple of other important organs we're going to get into, but let's talk about the traditional Chinese medicine approach first. So where do joint issues come from? We've already talked about too much exercise, for example, sporting animals that can get injured easily, or animals that don't get enough exercise. Injuries are also very common, not only in healthy animals that, for example, take a tumble down some steps, or repetitive strain injuries, if they're maybe too into playing ball or fetch. Older dogs also, and G stagnation are some of the more common ones, and we're going to get into points to help each of these as we progress through. And if you have any questions, please feel free to type them in the chat box and I'll be able to see them. Eastern medicine likes to look for the root of the problem. What we do is a complex assessment process because we use what's called the 4 exams. And if you've taken overview of TCM or our 2-day introduction to animal acupressure, you will know because we learned all about it and how to do a full protocol. But something that we like to harp on is that the internal organ systems are connected to their emotions. And sometimes a lot of people look just at the physical issues and not the behavioral issues that come with them or any emotional imbalances. Arthritis is a very complex issue, and for a lot of animals, this is a loss of their independence. When they start having to rely on their owner for more things, they maybe aren't able to do some of the things they used to be able to do, and that can be very frustrating for them. So it is a complex issue, and we're going to get into some of the reasons and ways that you can help. So first, we want to look at which organ system. And again, we're talking the Eastern organ system, not the Western version. The organ system in Eastern medicine comprises not only the physical organ itself, but the meridians and all of its functions and attributes that it's responsible for. Each one has a job. And if it's not doing that job to proper effectiveness, then we lose some of the functions and attributes. And that's what we see when we're looking at the animal. That's called indicators. So when we're looking at organ systems, there's one that governs bone, which we talked about as kidney. There's another pair that govern tendons and ligaments, and there's another one that governs muscle. So usually these are the 3 that are involved in joint pain, but we're going to get into it. One of the things we like to do in acupressure is set our healing intention. And this is a lovely picture of Amy practicing what looks like yin tang on the dog here. It's a point for focus, but in this case, we want to facilitate the resolution of joint pain and improve the qi flow. When we improve the qi flow, oftentimes there is pain relief, which is another good benefit of acupressure. And we're going to go into and learn where the aspirin point is. You haven't heard of it before. So there's a couple of ways that joint pain can present. Usually the most obvious for pet owners is an uneven gait. Maybe they have some cramped muscles or they're losing some muscle mass, usually in the end or limb that they're not using. So if they've had an injury, the muscle loss will be in that limb. Impaired mobility on stairs, whether that's getting up from the floor, any inclines, or jumping in and out of the car as animals get older. Usually we get a ramp or some steps to help them get in the car because we don't want them to have to put that strain on their joints anymore. Disinterest in usual exercise. If you have a relatively healthy animal that normally loves to go for walks and all of a sudden doesn't want to go anymore, this could be a good sign that they're having some pain, and acupressure is a great way to relieve some of that. Nails or hooves that chip or peel often. This one usually throws people off because they're not quite sure what that has to do with joint pain. But actually, the nails and hooves are governed by the liver and gallbladder, and they are also responsible for the health of the tendons and ligaments. So one of the physical indicators is that their nails or hooves will chip or peel very often. So something to keep in mind if you're looking at your own dog or other people's. New protective behaviors. These are the more behavioral based presentations. So in addition to protective behaviors, they could be less friendly around people or dogs. Maybe they're a little more protective of their owner because they see now their owner as their caretaker and sometimes have to help them get around or go to the bathroom. So they can become more protective of their owner and their resources, including their food. They may have discomfort being touched or be a little more irritable than usual. Jealousy or resource protection I kind of touched on, but these are the emotional attributes of the meridian systems we're going to look at. Whimpering is another indicator, usually of pain, and it could be for a number of reasons, but usually a combination of a few of these suggests that the animal is experiencing joint pain. So the first system we want to talk about is the kidney meridian. And we know that the kidney governs bone. And in Eastern medicine, this also includes bone marrow. So it has to do not only with the physical formation of the bone, but the strength of the bone itself. The kidney also governs birth, growth, reproduction, and development. So if you have an animal with a weak kidney, they may have some physical deformities when they're born, or they may have some as they grow. Maybe their hips are presenting a little bit unusually, and it'll show an imbalance. Commonly, this is arthritis, any bone or joint problems, developmental or dental issues. Now, I say dental issues because in Eastern medicine, teeth are seen as an extension of bone. So if we have an animal with dental issues, this is related to the kidney. And again, we know kidney governs the latest stage of life. This is usually when animals start to have problems with their teeth, if not sooner. And often their condition will worsen in the winter. This is when kidney is at its weakest. One of the other important related organ systems for joint pain are the liver, gallbladder, which are your wood meridians. And these two control the tendons and ligaments. So when imbalanced, we talked about chipped nails, but this also includes limb weakness. If maybe they're lifting their leg up and not putting full pressure on their legs. Could be irritability or anger. Liver and gallbladder, the emotion associated with our wood meridians is anger. So if you're noticing your dogs may be a little more irritable or touchy, this could be a sign that it's a tendon ligament related issue rather than one of the other two systems. And lastly, the condition will worsen in the spring. Our last set of meridians is stomach and spleen. These are our earth meridians. And there's some important functions here. First, we know the stomach breaks down food as it does in humans. In Eastern medicine, the spleen then takes that bioavailable nutrients to nourish the muscles in the forelimbs. So if either of these systems are not functioning properly, the food is not broken down properly, so the spleen cannot give the proper nutrients to the limbs, even if it's functioning correctly, or vice versa. The food is broken down correctly, but then the spleen isn't functioning well enough to carry those nutrients and nourish the limbs, you're going to experience muscle atrophy, soreness, arthritis, or pain of the stifle. The stifle is the back of the leg here, especially the medial side, because we know the spleen meridian, because it's dashed, it actually runs along the medial side of the hind leg. And their condition will worsen in late summer. So today is actually the fall equinox. So we are now officially in autumn, which is metal season. So stomach spleen issues tend to get a little bit better around this time. But as we progress into metal season, there'll be a couple of other issues that we present with. So now that we know these are the three primary organ systems that have to do with joint pain, let's look at some of the traditional Chinese medicine causes of joint pain issues. The first is qi or blood stagnation, depletion of source qi. Now, for those of you, again, that have taken either the overview of TCM or our 2-day class, We know that an animal is born with the highest amount of source qi. They will never get more than this. And as they get older, it slowly depletes. And if, for example, you have two healthy parents, you will have a baby with a lot of source qi. If you have two unhealthy parents, you will have an animal with a lower amount of source qi. If the animal experiences an injury or a chronic illness, there could be a sharp drop in source qi if they are not supported by the other forms of qi, such as lung qi and nutrient qi. But when an animal gets to old age, they experience the very minimal source qi, and as they run out, that is when they pass. So as the source qi weakens, the kidneys also weaken, which is one of the reasons that kidney governs the latest stage of life, because the source qi is housed in the kidneys. We're going to talk about that in a little bit. Lack of nutrient-rich blood to the muscles and the organ systems, too much or not enough exercise, neurological reasons, or proprioception, which is a fun word. We're going to learn about what it means shortly. And lastly, the invasion of external pathogens. So, qi and blood stagnation. And the river has rocks blocking a lot of it, or a beaver dam. Nothing can get through. And our job as acupressure practitioners is to slowly remove those blockages so the qi and blood can flow through and restore the river back to the way it was so everything flows harmoniously. We focus on the liver to harmonize the flow of qi because this is one of the liver's primary functions. The liver is responsible for the harmonious flow of qi, and if it is not flowing or if there's qi stagnation, we can use liver points to help balance this. Other ways that you can help with that stagnation is walking on uneven and different terrains and inclines. By changing the elevation, you're changing which muscles have to work, and the harder the blood is forced to move, sometimes this can help remove that stagnation if by increasing circulation. Again, stretches to help circulate. If you take your animal to physio and you learn some stretches to help them move that around, that will help. Acupressure is a nice addition to it because we can help energetically on the inside while the physio helps physically and externally on the outside. Depletion of source qi. So we mentioned that source qi is housed in the kidneys, and arthritis is a deficiency pattern. So if we think about excess and deficient, I know that we no longer teach it in the intro class because it's a complicated topic, but deficiency conditions are more common in older animals as their source qi runs out and their systems aren't functioning as well. So these are things we like to look at. Usually this results in a decrease in circulation to the limbs, decrease in mobility, and a decrease in exercise. So using kidney and bladder points on the meridians can really help during this time. The picture is actually a dog named Kazar that I worked on, and he had severe arthritis in his hind end. He is a classic German Shepherd with the sloped hips, and his hip dysplasia was very bad. And as he got older, this was probably about a month before he passed this picture, and he was having such deficiency issues, his owner had to strap his hind end to help him go to the bathroom. And it's very sad to see them at the end, but to know that I was there to be able to support him and support the owner and show them some pain management points to increase his circulation and things like that. He tend to like to have a nap during his session because it's very relaxing. All right. Lack of nutrient-rich blood. So this is usually, we touched on this briefly, that the stomach has not broken down the food effectively into bioavailable nutrients, or the spleen is not correctly nourishing the limbs. This is typically a cold condition. So if you think about animals with poor circulation, you think about cold limbs because the body is trying to maintain the blood that is there. They're trying to keep it to the trunk of the body, which is your abdomen area and the chest, to make sure that all the vital organs are staying safe. So usually animals that have this condition will have cold limbs. And this is Tessa. This is a horse I used to ride, and she is very senior. She definitely needed the exercise, but I noticed that before our sessions, her limbs were always cold, and after we would go for an hour ride, her limbs were a lot better. So sometimes having that exercise not only stimulates the circulation of the body, but it also helps to stimulate the stomach to help break down that food a little bit better. Because she liked to eat and stand still, horses are grazers, they need to keep moving around. So her having that extra exercise helped to improve the cold condition of her limbs. And if you do have any questions, please feel free again to pop them in the chat box. Okay. Too much or not enough exercise. So commonly in animals that get too much exercise, you see strains, sports injuries, or sore muscles. I've seen collies that have repetitive strain injuries from playing fetch too long, where the tendons in not only their elbows, she actually was diagnosed recently with arthritis in her elbows, and she's about 9. And she also has the beginnings of arthritis in her hips from the repetitive action of running, sliding, stopping, picking it up and running back, because they have such a high activity drive that keeping those dogs entertained quite often, I find providing intellectual stimulation, sometimes puzzles or sporting games like agility, are a little less stressful on the joints because they're moving in different directions, and the intellectual stimulation tires them out just as much. So just a helpful tip there. Not enough exercise is also a problem because it decreases the circulation to the limbs and usually results in an increase in weight. Now, animals that are overweight, this provides extra stress to the joints, not only the physical structure, but the joints and muscles and tendons have to work harder to support the body because of that extra weight. So I know a lot of animals that are overweight, but luckily with COVID, a lot of owners have been home. So I've seen a sharp drop in obesity, and at least in household pets, which is really wonderful to see. But that's something else that people sometimes overlook. When there's a couple of simple lifestyle changes you can do, whether that's gentler exercise, slightly decreasing or changing the amount of food. As animals get older, their metabolism slows down. And what people usually do is feed them more food when they get older. But science says that they actually need less calories because they're doing less activity. So talking to a holistic nutritionist about your animal's diet as they get older is always a good way to go. You can also provide supplements if you have the training or know someone who can recommend supplements for you. They can make a really big difference in supporting your animal's joints. Neurological proprioception. So proprioception means your body's ability to sense movement, action, and location, and this is neurological. So if you have, for example, animals that have a neurological issue when they're born, or they've had a head injury of some kind, this can lead to pain and compromised joints because they're not moving. Their body is not coordinating movement the way that they should. And often this is, for example, kittens that are born without the use of their back limbs. And sometimes they feel like they're moving, but it's not quite, their motor neurons are not functioning the way that they should. Often, if you meet this animal while they're young, you can take them to a vet to get a consult. And usually this is physiotherapy of some kind. There are a lot of people that don't want a special needs animal in their home because it is quite often a full-time job. I know there is a documentary out there about a woman who cares for only special needs animals, and it's really, really wonderful to watch that she has dedicated her time to looking after them. But she does work in conjunction with a lot of specialists to help make the animals' lives as pain-free and normal as possible. Invasion of external pathogens. So I read an article by our lovely founders, Amy and Nancy, and it's also in the AccuDog book. If you're curious, at the back, the section about specific conditions, there's a page about arthritis. And they talk about arthritis, osteoarthritis, and spondylosis being called a bony bi-pattern of disharmony. So that's a lot of words, but bi-patterns are a specific type of disharmony. And if you look into or have taken our indicators and assessment class, we go through all of the major pathogens and what indicators, what a bi-pattern is really, and what a bony bi-pattern is. But in short, it's a compromised immune system that is caused by pathogens. So when an animal exhibits arthritis, usually when they get older, this can be caused by pathogens such as wind, cold, damp, and heat. Wind is commonly called the master pathogen because it kind of opens the gate for the other pathogens to come in. And if an animal has a compromised immune system, as in the case with arthritis, this often brings in other conditions. As they stop moving and circulating because of pain from arthritis, their circulation decreases, which invites in cold. And as they stop moving, sometimes they'll lay around and the weather changes, and this can bring in damp or heat depending on where they live. But it's a very careful time where you have to really look at how you can support their immune system most effectively. And usually with invasion of external pathogens, you have to figure out which one it is first, because each one affects the organ systems differently. And some organ systems are more susceptible to certain pathogens, as we would imagine. Usually to support the immune system, we look first at lung points, because the lung governs the immune system and also helps to make sure that the Wei Qi, W-E-I, Wei Qi is the animal's energetic immune system. And in order to support this immune system, we have to make sure that they're breathing in healthy air, their lungs are able to move that through and break it down into chest qi or zong qi. This is then combined with the nutrient qi from the stomach and spleen, and the two combine together to form that Wei Qi. So if they're not eating healthy and making sure they're getting fresh air and exercise, their immune system is going to be compromised. So making sure that Wei Qi is as strong as we can get it just to support them while they age. So now we're going to get into a couple of points, because I know this is the part people like the most once we get out of the theory and explanation part. So these are a couple of points for hips, and we're going to go through all of the major joints and look at some acupressure points. And then we're going to look at some based on the organ systems. So firstly, we have a chat question. What is the name of the documentary about the woman that cares for special needs animals? I can't remember right now. I will look it up and include it when I send out the replay. Good question. Make a note right here. Okay. Beautiful. Okay, whoops. There we go. Acupressure for hips. So hips are one of the most common arthritis areas that we usually see, because usually as animals get older, their hind end goes first when they start to lose muscle atrophy. So our first 3 points here, bladder 54, gallbladder 29, and gallbladder 30. The 3 together are called surrounding the dragon. And I know a lot of acupressure points have very lyrical names. These ones are specific to the hip joint because in Eastern medicine, they call the hip the dragon because it is one of the biggest joints. All of the other joints do have Eastern medicine names as well. But these are 3 very powerful points you can hold together. And you'll find the anatomical locations here. Basically, one is above the greater trochanter of the femur, one is below, and one is towards the head or cranial to the greater trochanter. So the first we're going to look at is bladder 54, and this one is at the coxofemoral joint. The coxo is in coccyx. It's one of the hip bones, and the femoral is the femur coming up from the stifle here, just above the greater trochanter of the femur. So that's this one here. If we know where the bladder meridian is, because we trace it 3 times during the opening and 3 times during the closing, as well as where our association points are. If you trace along that meridian, you'll know where to find it. The next 2 are gallbladder 29 and gallbladder 30. So gallbladder 29 is in a depression just in front of that same greater trochanter. So you can kind of see it. It's a little harder on black dogs to see. Most acupressure points are in little dips or depressions around the bones, which makes them easier to find because your finger just kind of slides into it. Gallbladder 30 is then on the other side in a depression midway between the greater trochanter of the femur and the tuber ischii, which is another bone of the hip. One other point I want to mention is bladder 40. So this one is usually the widest point of their hind leg. And this one is actually a master point for the hips and hind end, which helps to support the back also. And this is anatomically on a canine at the midpoint of the transverse crease of the popliteal fossa. So it's a lot of big words. Fossa means a little hole in the bone. So if you find the widest part of their leg, there's 2 ways I usually find it. One is sliding up the thin skin on the back of the stifle, up behind the knee. And it's almost where the fat of the muscle here connects to the bone. The other way is to slide down or go from the front of the knee to the back. But all very helpful points if you have or know a canine with arthritis. Remember, all of these points are also appropriate for horses and cats. Anatomically, on a horse, they'd be in a little bit different location, a little bit further apart, because obviously their hip joint is a little bigger, but usually these are the go-to points for hind end issues. Moving on to the shoulders, there's 2 points that are especially helpful, and we have a couple of other distal points, which I'm going to get into in a minute. But the first 2 are triple heater 14 and large intestine 15. And these 2, one is at the front of the shoulder blade and one is at the back. And when I say this, I'm not talking where the bladder meridian is, how bladder 11 is at the front of the shoulder blade and bladder 13 is at the back. It's the lateral side of the shoulder blade near the base. Triple heater 14 is at the back edge of the deltoid muscle. So that's this one here. Large intestine 15 is in front of and above the acromion. So these are a lot of big anatomical words, but if you have the meridian chart, they're a lot easier to see. And it's also at the front edge of the deltoid muscle. So we have triple heater 14 at the back edge of the deltoid muscle and large intestine 15 on the forward edge of the deltoid muscle. There's also small intestine 9. Now, small intestine seems like a strange point to a lot of people to help with the shoulder, because the intestines are located in the lower body, as is the large intestine. The small intestine, because of its anatomical location of the meridian, actually helps a lot with shoulder issues. So small intestine 9 is found in a large depression along the back of the deltoid. So you can see the three are very close, similar to surrounding the dragon point combinations, but small intestine 9 is especially helpful for maintaining shoulder and joint function, which is really helpful. One other one that I usually like to throw in if the animal is sensitive around the shoulder is small intestine 3. And this one is a distal point for the shoulder. And what that means is it's away from the trunk of the body. So distal points are usually on the feet or lower limbs, and they help to support areas that are maybe a little more sensitive. If your dog has an injury to the shoulder, it would be easier to work small intestine 3 than the other points listed here. Small intestine 3 is anatomically, it's on the lateral side of the 5th metacarpal. So if you're looking at your dog's foot, it's the most outside toe, and it's just above where the metacarpals join together. So if you're looking at their toe bones, it's where their 5th toe joins together. On a human, it's the lateral side of the little round bone at the top of the wrist, just slightly lateral to that. It's hard to describe without a picture. But if you have any questions about these points, please let me know. We're going to move on to elbows. So we have some equine pictures in here for our equine students as well. For elbow issues, there's a couple, again, local points, which are points near the issue itself, and there's a couple of distal points in there. So large intestine 10, it's also called arm 3 mile, and I'm going to explain why in a minute. But anatomically, it's located very close to large intestine 11, which is one of our good allergy points. But if you know where large intestine 11 is, large intestine 10 is slightly more distal towards the foot, down that meridian. And it gives the same anatomical description. Too soon, distal to large intestine 1. I believe that's supposed to say large intestine 11. In a depression, cranial to the elbow. I know a lot of these anatomical words may be confusing, but if you can find large intestine 11, which is in the crook of the bone right here, slide down too soon, and you'll be able to find that depression right there. Now it's called arm 3 mile because there is an equivalent point on the hind end called leg 3 mile. And these 2 points are used in conjunction for endurance activities. And if the animal is sensitive on the back limbs, then you can use arm 3 mile as the equivalent, and vice versa. So if the animal is sensitive on the front limb, you can use the equivalent point on the hind limb to help with arm 3 mile. Small intestine 8 is further along the back of the elbow. It's in a depression between the elbow and the lateral epicondyle of the humerus, so your big elbow bone here. You can kind of see the curve right here of the elbow. This will be a bony area, and you should be able to find the depression quite easily. It is the most lateral of the 4 limb meridians, if that helps you find it. One more local point is triple heater 10, slightly more cranial, meaning towards the head, than small intestine 8. And this one is in the upper curve of that lateral epicondyle of the humerus. Anatomically, it's one soon craniodistal, meaning towards the head, but also down the leg, to small intestine 8. So if you found small intestine 8, it's one soon towards the head, and distal meaning down the leg. The distal point for elbows that we like to use is triple heater 3. And this one is a little bit further, but usually the horses are quite cooperative when it comes to using points on the leg. This one is on the lateral aspect of the midline of the fetlock. So these are a lot of anatomical words. The cranial midline means the very front of the leg towards the head. So it's slightly lateral to that midline on the fetlock here. A third of the way up the cannon bones. The cannon bone is this bone right here. And you'll notice 2/3 would be about where my mouse is. So 1/3. And we know that the triple heater meridian comes up on a dog, the 4th digit. So it is more lateral than the midline. So this anatomical description, lateral to the midline of the fetlock, would make sense. It's not the most lateral because we know that's small intestine, but triple heater is 1 meridian in if you're counting on the forelimbs. So those are our elbow points. And of course, we can't forget the knee and the stifle. We have a couple of helpful points here. Bladder 20 is actually an association point for the spleen that governs the muscles in forelimbs, which is why it's included here. Stomach 35 is another helpful one. It's a local point because it's directly on the knee. So if the animal can tolerate being touched there, I wouldn't recommend using local points directly after surgery because they will be sensitive in that area. So choosing more distal points at that time would be very helpful. Gallbladder 34 is one of my favorites. It's also a local point, but it's an influential point for tendons and ligaments. Because we know liver and gallbladder govern tendons and ligaments, choosing gallbladder points is usually very helpful. I find most people tend to forget about the wood elements because when we learn about them, they're the last 2 pairs, and usually people's brains are fried by then, but they're underrated and I like to use them. So gallbladder 34 is the 2nd most lateral meridian. We know bladder is the most lateral on the hind leg because it ends on the most lateral aspect of the hoof or on the lateral aspect of the 5th digit if we're talking about small animals. If you're trying to find it anatomically, it's in the interosseous, which means between the bones, space between the tibia and fibula, which are the big bone at the front and the small bone at the back here. Between the long and lateral digital extensors, those are the names of tendons. Craniodistal, which means towards the head, and down the leg to the head of the fibula. So it's going to be slightly, find the head of the fibula, go forward and down. And there'll be a space there between the tibia and fibula where you'll find gallbladder 34. If you're having a hard time finding this one, you can always trace up from gallbladder 40 when you find that on the leg, because if you know where the gallbladder meridian starts on the hoof, you can trace up. As long as you don't go into the bladder side, which is a little bit further back, you'll know you're on the right track. One of my favorite combinations, which I actually used today on a new dog, is kidney 3 and bladder 60. Now, these 2 are especially helpful for pain management. And I know I mentioned briefly at the beginning an aspirin point, and I know it's only one of them is on this picture here. Bladder 60 is also known as the aspirin point. And kidney and bladder together are the water element, which help to govern bone. So this is a really great combination, not only for pain management, but helping to strengthen the bones. So you can see kidney 3 here. It's in a small depression between the medial malleolus, which is this here. Medial just means on the inside of the leg as opposed to lateral, which is on the outside, and the tuber calcaneus. So this little knob right here, which you can see also here. Kidney 3, if you slide your fingers down the thin skin on the back of their leg, you'll be able to slide into kidney 3. Kidney 3 is on the medial side or the inside of the leg. Bladder 60 is the equivalent on the lateral side. So you would find it right here. So you can actually hold them both together And there's a couple of other point combinations, but for joint pain, this is one of the best ones. Kidney 3 and bladder 60 can be held together. And if you're working on a more senior animal, instead of counting as 4 points, because you have kidney 3 and bladder 60 on the left side and the equivalent on the right side, they only count as 2 because you're holding them together. So you have 1 point on this side and 1 point on this side, which is really helpful when you're working with older animals and you only get to choose 2 to 3 points maximum. Having point combinations is a really helpful way to kind of energetically support the animal without overwhelming them. So we have a couple of other acupressure points that if you know whether it's a bone issue, tendon or ligament or muscle, you will be able to support. So kidney 3, we already talked about. This is a great one for bone. We also talked about large intestine 10 when it came to elbows. Large intestine 11 is also great for bones, specifically elbows, but it can be found a little bit higher up here. One other one that I like to include is bladder 11, which is at the front of the shoulder blade, both in horses and dogs. Bladder 11 is not an association point. It's actually the influential point for bone. And anatomically, it's a local point for the shoulder because of where it's located. So if you know that bladder 11 is located at the back end of the shoulder blade or the scapula, we know that bladder 11 is located at the front. So a really great addition, especially on horses if they're being ridden a lot. The area around the shoulder is usually sensitive, so it can be a really great way to support them. We also have bladder 40, which we talked about here, the master point for the hips and back. So if you have an animal with tendon and ligament issues, these liver gallbladder points are very helpful. Gallbladder 34, we also talked about here because it is the influential point for tendons and ligaments. Another really helpful one for tendons and ligaments is the source point for the liver, which I'm going to see if we have any. Nope. Okay. Liver 3 is a medial meridian on slightly more lateral than the spleen. So we have spleen is the most medial. Liver is the next most medial. So it runs slightly cranial, meaning towards the front of the leg, but not quite dead center. Liver 3 would be around here. And it's because it is the source point for the liver, it helps to support the whole system and the liver gallbladder meridians together. A couple of ones for muscle that we talked about, spleen 3. So if we know that liver 3 is here, spleen 3 is going to be more medial, so towards the inside of the leg. And spleen 3 is the source point for the spleen meridian. It's specific to help with stifle issues, which is really great. Another helpful point for muscles themselves is bladder 17, which is on the back. So we know that the association points, when you're counting them, go 13, 14, 15. You skip 2, and then you start again at 18. So bladder 17 is actually not an association point. It's the influential point for blood and the diaphragm. And why I say it's helpful for muscles is because the blood and the stomach are the originators of fluid, and the spleen is important for keeping blood in the cells. So if you're able to support the blood, this will improve not only circulation, but it will help to support the stomach and the spleen to spread those bioavailable nutrients to the muscles in the body. And bladder 17, if you know 13 is the base of the back of the shoulder blade, count forward. 14, 15, 16 would be about here. Because if you're counting back from 20, you'd have 19 and then 18. One other point that I really like for muscles It's also a general immune stimulator. So if you are working with an older animal, it'll be really helpful. Is stomach 36. And those of you that know me, this is my favorite point of all time. I'm a little bit biased, but stomach 36 is the master point for the gastrointestinal tract, your entire digestive system. It's also located on the knee here, and it's an immunostimulation point. It's a local point for the knee. It helps to support the muscles, the digestion, and all of that good stuff. So if anybody has any questions, now would be the time. I know that was a lot of points. Don't worry, you will get the replay sent out tomorrow, so you can practice finding these points and look up the names or locations of any of the ones that aren't specifically listed in the pictures here. Just gonna stop the screen share for a second. There we go. Okay, so I'm gonna just let you know about next month's webinar before we open it up for questions. So next month, the webinar is gonna be on Monday, October 25th at 6:30, same time as usual. And we're going to go through some more case studies. I know we did this when the webinars first started, but I find that the case studies are very helpful because we can practice our indicators, looking at all of our indicators, our point selection, our session principles to figure out what our plan is going to be going forward. And the point selection part is always very helpful. You will get sent the case studies ahead of time so you can get a chance to prepare some things as we go through to do kind of a little self-test to make sure that you're on the right track as you're testing these out. So if anybody has any questions, now is the time. I know that was a lot of information. No, oh, no questions? All right. Well, that's all I have for this month. I know, again, that was a lot of information. If you know at least what joint on your animal is hurting, these points can be very helpful, because I know sometimes if their gait is a little bit uneven, it can be hard to tell whether it's the left side or the right side, and whether it's the front end or the back end if they're struggling gait-wise. But having an acupressure session and using those association points to help you figure it out can be a very good way to narrow down the indicators a little bit.